Okay, hello guys, Dr. Borys here. I hope that's everything good with you because I feel well and want to give it to you today the base information about the arterial system. It's a part of the cardiovascular system. Okay, if you're ready, let's go in. As you know, there are three kinds of blood vessels. You know this. It will be arterials, elastic arteries, distribution arteries, arterioles, and capillaries, smallest blood vessels. It's arterial system, right? And what about the venous outflow? It's a venous, smallest one, veins. It's big or large collective vessels such as the subclavian veins, jugular veins, renal, iliac veins, and three big veins, vena cava inferior, vena cava superior, right? And vena porta would take venous blood from the ampere single organ of the abdominal cavity. But about this, we have a separate lecture about veins. Okay, so what about the arteries? In this picture, you can see the blood moving inside heart, right? Now have a pump, and its big circle start in the left ventricle, right? And arterial blood goes into the arch of aorta, biggest arteries in whole body in this place, right? After this, arch of aorta coming downstairs, and in this place have the name the thoracic aorta. Thoracic pass through the diaphragm, musculus phrenicus, largest breathing muscle, and have the name the abdominal aorta. Abdominal divided for the two biggest iliac arteries, common iliac arteries left and right, which divided for the external and internal, that's right, and external iliac arteries. External, it's blood supply to lower limbs. Internal blood supply the organ of the pelvic region. What about the abdominal cavity? We have parietal and visceral roots. Parietal, it's a four wall. Visceral for the organs. Per and ampere visceral. Uh, ampere, it's you can see it here. It's iliac trunk, mesenteric superior, mesenteric inferior arteries. In the lower limbs, it's biggest arteries. It's femoral arteries, tibial anterior posterior arteries, plantaris arteries, right? In the upper limbs, you can see the subclavian arteries, axillary arteries, brachial and radial ulnar arteries, and the palmar arch, right? Blood supply of the hands. In here, you can see the iliac, sorry, iliac here, uh, common carotid arteries, which divided for the external internal carotid arteries, external for blood supply the um, face and head, right? And internal for blood supply the brain, blood supply the brain. So our lecture is finished, right? I give it you full information. So sure, it's a joke. Okay, uh, go on. Let's continue. What about function of arterial vessel? So for function, right? It's transport, it's distributive, exchange, and regulatory. Uh, in artery is an oxygen-rich blood present that moves from the heart to the tissue. Just one exception, the pulmonary arteries, which carry to lung venous blood pool or in oxygen. So, as you know, in the heart, we have some different because since, like I said, all the time, arteries include arterial blood, veins include venous blood, but arteries in the heart, for example, pulmonary trunk here, included veins blood. Arteries include veins blood, and pulmonary veins, and through pulmonary veins pass the clean arterial blood. So it's one exception, right? Things like I said here. What about hemicrotoculateral net? What is it? It's carry out the transition of blood from arterial vessel to the venous, provide metabolism. You can see arterial and venular. Here you can see arteriola, precapillary arterioles, capillary, venular past capillaries, and venula. You can see arteriola, precapillary arterioles, arteriola, capillaries, right? Postcapillus venula and venula here. Here you can see precapillary sphincter in this place. What about in this picture, you can see arteriovenous anastomose here. What about this anastomose? What do you have to know? Arteriovenous anastomose, AVA, it's connective arterioles and venules. So, first, there are two divisions, arterial and venular. Second position, according to Koprianov, there are AVA through which blood flow constantly and through which blood flow periodically. In the last arterial part can be closed using reduction of smooth myocytes to swelling of wall epitheliocytes. AVA, third position. AVA are reserved pathway through which outflow blood is removed directly from the arterioles to the venules. Fourth position. AVA regulate the capillary circulation, then way opening hemicapillaries less filled with blood, and then closed, the blood supply to the hemicapillaries increased. And fifth position, AVA is also involved in the processing of thermoregulation. On warm days, for example, the blood in the small diameter veins may pulsate and be red and the arterial occur from AVA opening account. In places, the precapillary arterial branch are divided on the hemicapillaries, a precapillary sphincter present. Here you can see precapillary sphincter. The almost of blood flow to the hemicapillaries depend on relaxation of arterioles and precapillary sphincters. Blood enters the capillaries periodically after relaxation precapillary sphincters. In each organ, there are functioning capillaries, open capillaries, and backup group of capillaries which not functioning because precapillary sphincters are shortened and blood into these capillaries do not enter. More activity body, so more capillaries function. At rest, for example, functioning of capillaries, it's a 23, 40, 40, 34% hemicapillaries observed. And during loading, it's 52, 60% works. Distribution of arteries. So, first, the main arterial trunk pass on the flexion surface of the trunk and limbs. Second, the arteries run deep between the muscle almost about near the bones, or near the bones, or almost above the bones. So like this one here. Arterial and magistral are divided according to the bone's base and on the periphery accurately connected. And fourth, in the area of joints, form arterial trunk branching in collateral arteries here, which connect with each other and form arterial network. So this one is picture about the arch of aorta. From arch of aorta start three branches, as you know, right? It's a left subclavian artery, it's a left common carotid artery which divided for the external and internal carotid artery, and in the right it's a brachiocephalic trunk which divided after this in the right common carotid artery and right subclavian arteries. In this picture you can see the external carotid arteries which have four group of branches. Front group, it will be thyroid superior arteries, the lingual arteries, the facial arteries, right? The back group, it will be occipital arteries, auricular posterior arteries, and sternocleidomastoid arteries. The middle group, it will be ascending pharynx arteries, right? And the terminal group, terminal, it's maxillary arteries and temporal superficial arteries. Okay, so it's an internal carotid arteries, right? Which made the circle of Willis the blood supply of the brain. Good. Circle of Willis, it's 9 arteries, and these 9 arteries located around the hypophyse. Hypophyse, it's a part of a hypothalamus, right? So um, this circle, it's 9 arteries, pair and unpair. So pair arteries, it's anterior, this one, um, anterior cerebral arteries here, medial cerebral arteries pair, and posterior cerebral arteries back one, and communicans arteries, posterior communicans arteries pair, and unpair anterior communicans arteries. So together it's 9. Don't forget about the posterior cerebral arteries made by divided of basilar arteries, but basilar arteries made by influence of the vertebral arteries, left and right. But vertebral artery is a branch of the subclavian artery, since like thoracic internal artery, cervical trunk, and costal cervical trunk. Okay, what about special features of body arteries? General special features. The arteries of the trunk save segmentation. The internal organs receive the arteries from department of an aorta and which level the developing of fetus of the body in embryogenesis. Arteries of tubular organ form arterial arches. Arteries of parenchymal organs pass to the body of them through gates. It's for the kidney, for the liver. In this picture, you can see abdominal aorta with celiac trunk, mesenteric superior arteries, and mesenteric inferior arteries. Here you can see arteria iliaca communis. This one branches arteria iliaca interna and arteria iliaca externa. This one parietal branches of arteria aorta, thorax, no, abdominal aorta. This way. What about celiac trunk? Here, sorry, you can see celiac trunk, which have the left and right, the stomach arteries, that for left and gastric arteries. Next, it's splenic arteries, arteries blood supply the pancreas, right? And common hepatic arteries, which divided for the arteria pancreaticodunalis, which blood supply the head of pancreas and duodenum, and the arteria hepatica propria. Arteria hepatica propria in company of ductus hepaticus communis and vena porta, located in the ligamentum hepatoduodenalis. It's a part of small omentum minus. It's a ligament of the thigh, actually, because if, for example, the surgeon cut this ligament when I have operation, for example, in the body, right? So the patient probably will be die because in these ligaments located these three vessels, arteria hepatica propria, ductus hepaticus communis, and vena porta. So in this picture, you can see the upper and lower mesenteric arteries. Arteria meserica superior, it's blood supply of the small intestine, as visible here, but the small intestine, ileum ileum, and part of large intestine, ascending and transverse part of the large intestine in second, right? And mesenteric inferior part, arteries, blood supply the descending part of the colon, sigmoid, and rectum, but just up at one set of the rectum blood supply. Okay, and what about the arteries of the upper and lower limbs? So this one you can see here, this. It's arteria subclave, arteria axillaris, arteria brachialis, radialis ulnaris, and up deep and superficial palmar arch, blood supply at the hands. Here you can see arteria iliaca communis, arteria iliaca externa, arteria iliaca interna, arteria femoralis, arteria patellaris, popliteal arteria here, and arteria tibialis, anterior, arteria tibialis posterior, and plantaris arteries, plantar arch. Okay, what about wall vessel? Wall of arteries vessel have three coverts: internal, medial, and external, right? Internal, it's endothelial. Medial, it's muscular. In addition to muscle fibers, contains elastic and collagen fibers. And external, adventitial, contains vessel and vascular nerves. The structure of the arteries, well, is divided into elastic type, muscle elastic type, and muscle types. And the position is like look like the closer to the heart, the higher the blood pressure and more elastic tissue in the wall of the arteries present. And when the farther from the heart, the decreased blood pressure, decrease blood pressure, and become higher muscle tissue. In this picture, you can see discharge anomalies of arterial branches from aortic arch. So, first, from the aortic arch, in addition to the usual three branches, one or two vertebral arteries can begin also, and unpaired thyroid artery. Second one, both common carotids start from arch by a common trunk, but subclavian arteries separately. And normally it's the elephant have this dislocation of vessel. Third position, both common carotid artery and both subclavian arteries depart from the aortic arch separately. It will be four branches, start from the arch of aorta. It's normal in the well. Fourth position, all branches joins in one common trunk. Its normal position in the horse body. And fifth kind, it's from the aortic arch start two brachycephalic trunk, each of which is divided into subclavian and common carotid artery. As a norm, it's a dolphin. What about development of the arteries? On set weeks of embryogenesis, from heart primordium depending arterial trunk, which is divided into two ventral aortas. Ventral aortas form the first, arcus brachialis, and send back, forming two dorsal aortas. Dorsal aortas influence and form common dorsal aorta. Aortas form another five more arterial branches. Arterial arches actually. It's together it will be six, which connect the ventral and dorsal aorta symmetrically. From common dorsal aorta, dorsal, ventral, and segmental arteries pass between summits. On the 27th day, the first aortic arch disappears almost completely. A little remaining part gives rise to the maxillary, facial, and superficial temporal arteries. Okay, the second aortic arch also disappears from its remnants and formed linguistic, ascending, pharyngeal, and stapedius arteries. Up to 29 days, peripheral developed in the embryo completely disaped of the first second aortic arch. The said aortic arch formed the general external and initial department internal carotid arteries. The rest part of the internal carotid arteries are formed from dorsal aortas. Fourth aortic arch form an aortic arch on the left, on the right proximal segments of the right subclavian arteries and brachiocephalic trunk. Fifth aortic arch is reduced. Sixth aortic arch gives rise to the right and left pulmonary arteries. The left sixth aortic arch is stalled, forming an arterial or botulic duct. From the lower part of the right dorsal aorta forms the distal part right subclavian artery. The descending aorta is formed from the lower part of the left dorsal arch. From segmental arteries form the left subclavian artery and arterials upper extremities. From dorsal segmental arteries are formed intercostal and lumbar arteries from the ventral segmental arteries, abdominal trunk, upper and inferior mesenteric arteries, umbilical arteries, renal arteries. From umbilical arteries developed iliac arteries and lower arterial limbs. What about anomalous arterial system? So, first, it's open duct arteriosus, it's bottle duct, occur in 8 cases per 10,000 newborn, more often in premature infants and in combination with other heart defects. Normally, the bottle duct closes within 15 days after birth, up to 3 months. Abnormal discharge of right subclavian artery occurs then the vessel is formed from the right dorsal aorta and the right fourth aortic arch obliterate, close. Right subclavian artery is located under the left subclavian artery. Since the subclavian artery at such anomaly of develop pass backwards, the esophagus can compress it. A patient foramen ovale, PFO, it's terminology, right, is a hole into the heart, then didn't close the way into short after birth. During fetal development, a small flap-like opening, the foramen ovale, is normally present in the wall between the right and left upper chambers of the heart artery. For example, my mother had this pathology. Actually, there are for 25%, right? People in the world have this pathologies, and a lot of scientific said it's not pathology actually. Mm, because but in my opinion it's this close must be this open must be closed, right? Because um, in human body heart the blood can't mix can mix, and if this open it's not closed, for example in my variant with my mother, so they probably developed the lung hypertension, uh, hypertension of the pulmonary trunk and lung veins, right? Um, because this veins in this situation will have under big pressure of the blood. Okay, go on. Continue. Patient foramen ovale occurs in about 25% of the normal population, since like I said, but most people which of the condition never know they have it. That's why. In a patient, foramen ovale is often discovered during tests for other problems. That's why a lot of doctors said it's not pathology, right? Meaning that you have a patient foramen ovale is understandably concerning, but most people never need treatment for this disorder. Next, here you can see pathology, right? It's a right aortic arch occurs when the left fourth aortic arch and the left dorsal aorta are reduced and vessels developed on the right side. Some it's difficulty swallowing in the patients is observed. Next pathology. Interrupted aortic arch is caused by obliteration of the left fourth aortic arch. And next, coarctation of aorta occur in the 3 cases per 10,000 newborn. This is a condition in which the lower position of aorta of the left of subclavian artery is sharply narrowed. In this picture, you can see the arterial obstruction by atherosclerotic plaque. So, you know this. Um, that's our bloodstream in our vessel um, must be pretty good, and for better transportation of the oxygen for our organ, for our muscle, for everything, right? And the image of the wall, on vessel wall, most of all, it will be the sugar. Sugar, the image, the internal wall, and the endometrium. When this internal wall have some defect, a lot of plaque located here, fixed in this place. So remember, when you wall of the internal wall of the vessel, it's have no any problem, right? Not sick. So any plaque not fixed here. Okay, what happens? This plaque fixed inside the vessel and close the part partly, right, um, open, right, inside the vessel, and we have narrowing of the vessel, partly narrowing of the vessel. Okay, so just a moment. I take a look in the about the about this picture, general picture, right? In a general picture, good. In this place, you can see the greatest magistral, right, of the upper limbs, of the lower limbs, and of the head and neck, and head and neck. So since like I said, the blood in the heart not mixed in the norm, right? The left part of the heart included the just arterial blood, the right part of the heart is just venous blood. Big circle start from the left ventricles and through wells of aorta goes into the arch of aorta. From arch of aorta start three vessels, right? Arch of aorta goes downstairs in this place in the thoracic part. It's thoracic aorta. In abdominal aorta, in this region, it will be iliac aorta, common iliac, internal external. Give it oxygen, our blood in the muscle, and the take the oxygenated blood and accumulated blood inside veins. Inside veins, the same names, veins, uh, blood, venous blood goes from the down to the up into the lower limbs, right, and accumulate in the vena cava inferior. Vena cava inferior. Vena cava inferior have the roots and take the venous blood from the anterior, from the pair organ of the abdominal cavity too. From anterior organ of the abdominal cavity, it's stomach, large and small intestine, ileum, ileum, and colon, right? Um, spleen. Um, these organs give it, this blood, venous blood, into the vena porta. Vena porta. Okay, from the lower limb, from lower part of the body, veins blood accumulate in the vena cava inferior from the upper part, vena cava superior, and goes vena cava inferior superior in the which chamber? It's a right atrium. From right atrium goes into the right ventricles. From the right ventricle starts small circle, lung circle. It's through the pulmonary trunk. Lung, pulmonary trunk, it's arteries, but included which blood? Veins blood. It's one place in whole body. When they have difference, it's different because an arteries included venous blood, right? And after this, the blood goes into the lung, take the oxygen and clean arterial blood through pulmonary veins, left and right, to left to right, goes into the left atrium, from the left atrium through the mitral valve, goes into the left ventricle, and once more start big circle. So that's why, since like I said in the previous lecture, you have to protect your heart because all the time pumping blood, all the time moving. Didn't matter. It's you're sleeping, walking, eating, uh, all the time walking. Okay, and our last slide. It will be about the. I have some information now. Oh, there's one information. It's you can see in this picture the student seems like you, right? But it was maybe 50 years ago, maybe more. So and study, I think that's it's skull, right? It's skull. Maybe found some channel of the skull, some open communicate of the skull. Why you have to know about this communicate? Because through this open, through this channel, pass the nerve, veins, and what? And the arteries. The main arteries, it's arteria carotica interna. Arteria carotica interna, which blood supply the brain and make the circle of Willis around a hypothalamus. Around hypothalamus. Okay, guys, so our lecture is finished today. I hope I give it the more necessary base information for your pretty good study as well. So have a nice day, have a nice time, and see you later. Bye, guys.